Hi, sorry I'm a bit late today. I wanted to come on at 7 Eastern. It's 7:34 Eastern now. I'm going to talk about mental health and try to give you some tips. And hopefully, if you're struggling, I can help you a little bit, a lot, somewhere in between. First off, it's if it's near the end of the day for you today, I just want to tell you I'm so proud of you for doing what you did today, for getting through today. So proud of you for doing that. I know it may feel like not much at all, that you didn't do anything. Maybe you sat on the couch all day. Maybe you simply did that. Maybe that's the best you could do. But I want to tell you that's phenomenal. Your recovery from mental illness is a phenomenal achievement, a phenomenal accomplishment. It's like climbing Mount Everest every single day. And I'm so proud of you for doing that. I'm so proud of you for keeping going on today, minute by minute, second by second, hanging on. I'm so proud of you. Good for you. Good for you. You deserve medals. Many medals for what you did today. Medals for bravery, for courage. You should be stood up in front of the Prime Minister of Canada, the President of the United States of America, whatever the leaders are in your countries, and have medals pinned to your chest. Good for you. Good for you. Amazing. Congratulations. I know you may not be able to feel that for yourself. I couldn't feel that for myself much at all. I knew in the back of my head, drowned out by many, many thoughts, many awful thoughts, loud, awful thoughts. It was just drowned out. Any sense of good for you, Matthew, for getting through today was just drowned out by my thoughts. And I know that's likely the case for you too. At least on the spectrum from mild to severe, you may be somewhere on that spectrum. You may be able to congratulate yourself more, maybe you can't. And if you can't, or maybe if you just sort of want, if you can kind of congratulate yourself a little, you too, I want to say congratulations to you too, for everybody. Good work. I know today is probably going to feel exactly the same as tomorrow. I know it's my days felt all the same, like Groundhog Day, the movie with Bill Murray. All days felt the same, day after day after day, the same thing. But I want you to know recovery is possible. It's possible to get better. It may seem like it's taking forever, but I want you to know that it's possible. You don't know what the future holds in store for you. You don't know what advancements in healthcare are coming our way weeks, months, years down the road. You don't know. I don't know. Nobody knows. Nobody knows. There is a vaccine for dementia that they're working on. If you Google it, it was December of 2021 when they started putting it in humans, seeing how it works. It was very effective in, I guess, I'm supposing animals. I don't know how they tested it, but they'd been working on it for many years. They say what it does is it goes after, and I'm going to get this wrong, but the immune part of the body, that's how it's affecting. That's what the vaccine is concentrating on or working on to help prevent dementia in the trials. And that was where cancer was 20 years ago. Cancer started concentrating on the immune part of the body. And I could be getting that wrong, but basically where they are with dementia now is 20 years later than we're doing the similar work that cancer was doing 20 years ago. So you don't know. They say within 5 years that vaccine for dementia can be rolled out, approved, and all that. They say that's likely the time frame that it will happen on. So 2022, so 2026, 2027, somewhere in there. So I know some of you may not want vaccines for dementia or vaccines for anything. My point is that we don't know what kind of advancements in healthcare are coming. We don't know. We just don't know. And that's why I know when you're sick with mental illness or depression, whatever, it's hard to think positively. I thought for many years, they'll probably won't find anything, it'll just be the way it is for years and years and years, and I'll just sit here and suffer. Maybe that's what's going to happen. I didn't know. But when you get out of that depression state and you start to think more positively and think, well, maybe they will. Think back the last 10 years. Think back to 2012 and what we didn't know what was going to come down the tubes. Did we see a pandemic coming? No, none was really thinking about that. Some 0.0000001% of the population was thinking about it. Anyway, go back to 20 years ago, 2002. Did we see all this coming? Did we see all this coming? So think what's happened in the last 10 years or the last 20 years and extrapolate forward another 10 or 20 years. Think what's going to come in the next 10 years from 2022 to 2032 and just things happening, things being discovered. Think back, think another 20 years to 2042. The next 20 years. 20 years can go by pretty quickly. 2042 will come just like that. And think of all the things that will happen in the next 20 years. It won't be just like today where we don't have this and we don't have this and we don't have this and we don't have this. Things will change. Lots of things will change. I mean, if you went back 100 years or 300 years or 600 years or 700 years and you forecasted 20 years ahead in the future, things might look pretty much the same. But at the rate we're going, exponential changes all the time. And yes, 10, 20 years in some ways could look a lot like it does today. There would be some aspects of life that'll be just the same. The sky will be blue. The sun will rise in the east and set in the west. It's some things are a given. Gravity will be here more than likely, but a lot of things will change. And I just want to give you some hope. If you're thinking they'll never find a cure, this is the way it's going to be forever, don't give up. Please don't give up. They've done studies of people who've actually, who was it? Zach Williams, Robin Williams' son. He said recently that, and I'm pretty sure it was him. He did an article for Time in Time magazine recently about the new 988 number for mental health crisis that was just launched in the States this July of 2022. And in the article, I'm darn sure it was that article. He said that it's been well documented that people who've attempted suicide regret it. And if you look up Kevin Briggs, his TED Talk, he talks about that. They say many people regret it instantly from the point of no return. When they say, oh my gosh, they instantly regret it. Emma Benoit, she's from Louisiana. She's early 20s, I think. She has a movie out called My Ascension. It's a film about her. She was like that. She instantly regretted her attempt at suicide. And please watch her movie. It'll be coming out on PBS in this fall in another month or two, I believe. That's what they're saying. And the movie can be screened. You can host screenings at schools. I would love to see that movie screened in schools all over the place. They're trying to get that screened in schools all over the place. The screenings, I think the lowest, they've got different packages. You can get a $2,500 package and have Emma and the director of the movie, Greg DeCherry, I think that's how you say his name, and they can do a virtual Q&A after the screening of the movie with your school or whoever you're showing the screening to. And there's a cheaper pack than some other packages. I think the cheapest one is about $400. And yeah, that would be wonderful. I haven't seen the movie yet, but I'm really looking forward to it. Greg DeCherry also did the movie The Ripple Effect with Kevin Hines. Kevin Hines attempted suicide and survived, and the movie was about his life, and that had, big movies to watch. They're really helping a lot of people. So if you can't see the movie, My Ascension with Emma Benoit, on the My Ascension YouTube channel, you can see recent videos they have on YouTube. They have some Q&A, hour-long Q&A with some schools. They've got maybe 3 or 4 of those on their YouTube channel. You can watch those and sort of see what kids are saying. What are the questions the kids are asking about the movie? What's the conversation? get into the most recent, and these Q&As with Emma and Greg DeSherry happened just in the last handful of months as the movie's been coming out and they're screening it more. So yeah, don't give up. There's when you get to the other side, when you get when you start feeling healthy and clear in your head, and it's just absolutely wonderful to see just the sheer beauty of life. It's blocked from you. It's blocked from you for me. It was blocked from me for so many years. So many years it was blocked from me. And now I get to see sheer beauty, the wonder, the magic, the miracle of life. It's right before us every day, right before us, just wonder, absolute wonder. The fact that we're even here on a planet spinning around in a massive, unbelievably massive universe is just, it's hard to even think about. And just to even try to contemplate it is a sheer gift. And I've gotten that again. For so many years, I couldn't have thoughts like that. I couldn't think about, it felt like I didn't have time to think about that. I was just so busy in fighting for the next moment, fighting to get through the next few minutes, fighting for this, fighting for this. How am I going to do this? How am I going to do that? I don't know if I can do this. I don't want to do this. This hurts. I'm in mental anguish. How am I going to do this? And keep fighting. Please keep fighting. I know it's a slog, to say the least. People would say it's a test, a challenge, and I particularly didn't like those words, test or challenge. I thought, man, a test. People sign up for a test. People sign up for a challenge. They want to get their certificate, their degree, their exam so they can do this and that. This was no test. I did not sign up for mental illness. But some people say that when they get through the other side, that, and not just for mental illness, but other things too, other horrible things that can happen to you, they say, as much as I did not want to go through that, and I would never want to go through that ever again in my life, that was the best thing that could have ever happened to me. The best thing, the absolute best thing. I'm so grateful for that experience, for what I went through, for all the things I learned, for how much stronger it made me, for how much more resilient it made me. You sit back and you think, wow, I actually did that. I actually got through that for weeks, months, years, however long. I actually got through that. And it's nice to simply put your feet up and say, wow, I did that. And it's wonderful. The book, The Survivor Personality, talks about that. But the book's written by Al Siebert. He says that's what a lot of survivors do. People who've gone through the Holocaust, natural disasters, cancer, alcoholism, all sorts of things. They say, I'd never want to go through that again, but that was the best thing that could have ever happened to me. They have so much more love for life, so much more appreciation. And it's, I know it's tough. For years and years and years, I fought not being able to feel that or think that, just struggling, thinking, I don't want to go through this. I don't want to go through this. But congratulations for getting through today. I know today is going to be another slog for you. I hope it isn't, but chances are it will be, but you never know. Things can improve. Be thankful for the little thing. I know it's hard to be thankful. It was so hard for me to feel grateful. But tomorrow something may happen. Maybe it was today something happened to you. And they're little wins. Maybe they're big wins. I mean, I lived in a group home for 3 years, and I remember when I got my first apartment outside of leaving the group home. I was living for the first time independently. For the first time in my recovery, I'd lived independently before then. And just the feeling of getting my own apartment, being out of the group home. Wow, that was a big win. And yes, I couldn't feel super great about it, but somewhere inside you, it resonates, somewhere inside. And these little things, try to do things anyway. Things that you like to do them anyway. Even though you may not be able to feel good doing them, do them anyway, because at somewhere inside you, they resonate with you. Somewhere inside, they give you confidence, they give you some pleasure. It feels like they don't resonate, but they do. They really do. And keep going. Keep trying to do the things that you like to do. There's a book. I think it's called Spark, and it's written by the mom of this boy. Forget his name, but he was a genius. He had autism, but he was a genius. A phenomenal story. But his mom, who worked with special needs kids, she says with the special needs kids, before you focus on trying to make them things that trying to work on their weaknesses, you have to focus on their strengths. Focus on building your strengths first before you start to try to work on your weaknesses. If you're good at something, try doing that. Even though you're mentally ill and you can't feel good doing it, try working on it. Do something. Try to do the things that you like to do. It's yeah, you can look back in your life and you can look back in your recovery and think, you know what, I wasn't feeling the best, but I did that anyway. I did that anyway. I did that despite I wasn't feeling good. I did that anyway. And you can give yourself a high five. Years later, you can give yourself a high five. That day, somewhere inside of you, it'll resonate. There'll be a high, you'll be giving yourself a high five. You may not be feeling that great about it, but it'll happen. It'll resonate within you. And years later, you can say, I did that. I got through. I fought through. I fought for my recovery. I did that. I actually did that. I fought and I fought and I fought and I fought and I fought, and I didn't know if I'd ever get through it, but I did it. I fought and I won and I got my health back. So all these things you go through each day, slogging, they all add up. They're all bricks in the wall, not to quote Pink Floyd in sort of a reverse way, but they're all bricks in the wall. You're building brick by brick by brick. You're cutting off mental illness. You're getting it out of your body. Awesome. Congratulations. Keep going. I try to keep these around 20 minutes. So I just want to say that thanks for listening. And for people who want to help people with mental health in developing countries, that's one of my main causes. People are suffering, people are kept in chains. Go to hashtag break the chains. The link is at my MindAid website, mindaid.ca, mindaid.ca. There's a link there to hashtag break the chains, and or if you just type that into your browser, it'll take you to the website. It's a Human Rights Watch, hrw.org. something. Just type in hashtag break the chains. It'll take you there. And you can sign a pledge. There's a pledge there. They need more signatures, and it's to help people get unchained with mental illness. It's some people are tied to a tree, tied to a bed, with their foot through a log, and with untreated mental illness in poverty in some developing countries. And you can help stop that. 7 nonprofits that I steer people towards, they're listed on my website, mindaid.ca, under the donate section. Some of those help unchain people. You can donate to them, fundraise for them. There's Strong Minds, Fine Mind. Please pay attention to Fine Mind because they're relatively new. Around the last 3-4 years, I think they've been working, and they would love some extra support from people to help get their feet underneath them. They're doing great work because, I mean, they've got Forrest Whitaker, the Hollywood actor, his foundation. He was recently in Star Wars. His foundation is helping to work with Fine Mind, and Fine Mind right now is working in northern Uganda, getting people mental health care. So if you could donate or fundraise to them, $3 a month, $5 a month is just, your pocketbook wouldn't even notice that. And that can help. Every little bit can help. Strong Minds is another one. Basic Needs US. The Minds Foundation, they work in India. Sight Corps Ghana, they work in Ghana. And then the other two work not just in mental health, but some other areas too, like education and whatnot. Those two are CBM UK and Partners in Health. And there's a Partners in Health Canada branch too. So check those out. They are wonderful. I'd love more people to donate and fundraise to them. Join my Facebook group, Facebook group. It's on the Minded Facebook group. If you want to meet other people with mental illness, or other people trying to help people with mental illness in developing countries, there's about 70 members there. So I'd love to see that, more people in there with more discussion, more brainstorming. Uh, put a bake sale on. Put a bake sale on. Donate. Fundraise fundraise some money for one of those 7 nonprofits that you can donate to on the website. I would love if more people knew their names, those names I just said, Strong Minds, Fine Mind, and the others. I would love if more people knew those names and they can build their capacity, got more money to them. They're helping people get basic mental health care in developing countries. These models of basic mental health care are low cost, proven effective, and scalable. And the World Health Organization is trying to figure out the best way to roll them out to the masses. In the meantime, these groups are doing it. They've helped thousands and thousands and thousands of people for years. Basic Needs US was the first one, I think, made in the year 2000. They've been around for 22 years. Riot Games, creator of the massively popular video game League of Legends, they in 2017 gave $1 million. They asked their gamers to vote on 3 charities to donate $1 million to, and Basic Needs won. Basic Needs got $1 million from Riot Games in 2017. I'd love to see more large sums of money go to those groups. Anyway, have a good night. Thanks for listening, and I'll talk to you later.